Alberta has a bad case of the measles, its worst case in decades. As we record this, more than 500 people in the province have been infected since March, most of them children. Only Ontario has confirmed more cases, north of 1,000 over the same period. In terms of infections per capita, the rate in both provinces is about the same. Doug Ford sounding pretty fed up.
How do you force someone? Do you grab their kid and start jabbing them with a needle? It's a problem. I agree. But we're throwing everything in the kitchen sink at this.
As for Alberta's premier, she's taken a different approach. While the province is now in the midst of a major awareness campaign, Danielle Smith has said very little about the need to be vaccinated, and experts like this professor of health law are worried.
I think it's sent a message that it's not crucially important that you go out and get vaccinated. And so if they don't treat it as important, then the public's not going to treat it as important.
So what's up? Well, Lori-Ann Hardcastle believes it all comes down to Alberta's particular brand of post-pandemic politics. Let me explain. Back when Jason Kenney won the 2019 election, public opinion about immunization was pretty settled in Alberta. Just ahead of the vote, some 74,000 Albertans responded to an online Vote Compass questionnaire, and 68% of respondents strongly agreed that routine vaccination should be mandatory for all students in Alberta schools. 63% of those who planned to vote for the United Conservative Party felt the same way. Compare that to these findings from last year. Citing the re-emergence of diseases such as measles, the Angus Reid Institute asked Canadians if vaccines should be mandatory for school-aged children. Now, although we can't directly compare the two surveys, the newer data suggests fewer people now believe in mandatory vaccination in schools. Only 48% of the Alberta respondents in this survey answered they should be mandatory. The same poll found that 50% of those who voted Conservative in the previous federal election were either anti-vax or vaccine skeptic. The pollster didn't break those details down by province, but Alberta is the Conservative heartland of Canada. So what changed between 2019 and 2024? Well, obviously, COVID came along. And in Alberta, more than any other province, the pandemic led to political upheaval within the governing party. Hardcastle thinks that's still reverberating today in how slow, even reluctant, the government has been to respond to the measles outbreaks.
I do think they were reluctant. I think that they're trying to navigate and strike a tricky balance between those members of their voting base who are opposed to vaccinations or who are opposed to what happened during COVID.
We all know that the rapid emergence of new vaccines and the vaccine mandates that came with COVID created skepticism and backlash. That's where the politics of vaccines started, with the restrictions. Hello, Ottawa occupation. And in Alberta, it cost a premier his job.
I have informed the president of the party of my intention to step down as leader of the United Conservative Party.
Jason Kenney resigned after facing an internal party mutiny, largely fueled by his handling of the pandemic. Many UCP members didn't like the vaccine mandates. Danielle Smith was one of them. In fact, she was outright skeptical of the mRNA vaccines and had even flown to the States to receive a jab that wasn't available in Canada at the time. Smith won the UCP leadership, became premier, and in one of her first statements had this to say about the unvaccinated.
They have been the most discriminated against group that I've ever witnessed in my lifetime.
Smith struck a committee to review the province's pandemic response. Its final report recommending healthy children and teens be barred from receiving COVID shots. That was in January. Just 2 months later, Alberta's first cases of measles popped up and then kept popping up. So you might expect the province's chief medical officer of health would pop up too, with a press conference advising Albertans to get vaccinated. It didn't happen. And by early April, doctors were publicly raising concerns that Mark Joffe may have been muzzled. Joffe then quit and wrote an op-ed warning of the threat of measles and the need to be vaccinated. He hasn't done any interviews, but in a measles-focused presentation at the University of Alberta, the former top doctor for the province said this about the response to the outbreaks.
I think there has been a complete failure of leadership at all levels. We need leadership at all levels. I probably can't say a whole lot more about that, but we need a whole lot more leadership.
It wasn't until May that the government held its first measles press conference, announcing improved access to the vaccine and that new awareness campaign. By then, the case count had reached levels not seen since the 1980s. Joffe's replacement was asked how confident he was the outbreaks can be reined in.
We are now taking active steps through immunization programs to try and stem that growth. It'll take a couple of weeks to months to see the fruits of that effort. It's not a quick thing.
Hardcastle thinks they'll have their work cut out for them. The rate of kids being immunized for measles has dropped since the pandemic. In 2024, the percentage of children who received the recommended 2 doses by the age of 2 was well below 50% in some communities. Infectious disease experts say about 95% is what's needed to achieve herd immunity.
If you wait for cases to spike before you finally have a press conference and implore people to get vaccinated, in some ways it's too late. People have already got measles at that point.
We asked the province why it took so long to hold that news conference and ramp up its response. In a statement, officials insisted that since the beginning of the outbreaks, the government has taken swift and proactive measures, with the response escalating as the situation changed. They also pointed to the fact that the vaccination rate has ticked up considerably in recent weeks. But the virus spreads quickly. Measles is a highly contagious airborne disease that can lead to a host of severe outcomes, including death. It's why for decades the importance of vaccination has been stressed by Alberta governments of all stripes, until just a few years ago, when stressing the importance of a long-standing health practice became political.